Serving all of San Diego, this is your Fox 5 News.
Well, you know that feeling you often get when you begin a new relationship? Well, now scientists are looking for ways to bottle it up and help couples. Rose Hartzel, sex therapist and researcher at San Diego Sexual Medicine, is here with more on these love and lust drugs. Good morning.
Good morning. Thanks for having me.
Yeah, thanks for being here. So what is this new drug and how are they bottling it up for us?
Well, there's two drugs I'm going to be talking about today. The first is oxytocin, and about a quarter of women experience some trouble with climax, and oxytocin has been shown to help to increase that in women. It's not FDA approved, and San Diego Sexual Medicine is doing the first double-blind placebo-controlled study in the world.
Oh, wow.
So that's pretty awesome for San Diego.
So you were actually saying that this can make people feel close to someone else, almost can it be a false feeling of closeness? How exactly does that work?
It can help with climax, but what it's originally known for is being the love hormone, and it's been shown in pair bonding and attachment. So when you were on The Bachelorette, this probably wouldn't have been a drug that you wanted to use. It'd be really confusing.
I would have been like, I love everyone.
Exactly, you would have felt attached to everyone. So that's one interesting thing about the drug.
Right, so are you still getting into specifics about how to take it, when to take it? Are they supposed to take it maybe before they think they're going to have sexual activity, or is this something you just take daily?
It's a lozenge, and you would take it an hour before sexual activity, and then you would see what happens.
Is this for women and men? You know, because we've heard of Viagra, which is like the male sex drug, and then is this like for women and men?
It's for women and men, and I'm glad that you brought up Viagra, because that's the second drug that I was going to talk about today, and that can benefit women as well. A lot of women don't know that. It can benefit women in two ways. One is that oftentimes when a male has sexual or erectile dysfunction, it can be difficult on the relationship. And not only is the male suffering with difficulty with erections, but the females can get low sexual desire, difficulties with lubrication. And there's been two studies recently published in the Journal of Sexual Medicine, which the editor is here in San Diego, showing that the female partners of the men who take this drug get increased lubrication after their male takes it, and their desire increases. They feel closer to their partner. They experience a relationship as more safe.
When the male takes it.
Exactly.
Oh, wow.
So it affects the woman as well. In addition, women can take, and this is not FDA approved, so this is off-label use, but women can take a quarter tablet of Viagra, and it can increase blood flow to the genital area and help to increase their sexual experience as well.
Oh, wow. That's really interesting. So what kind of, I guess, results are you guys seeing? Or you're just actually
in terms of oxytocin, we're currently doing research on that right now. So a lot of this stuff is in theory. In Viagra, there has been research in men, and we're hopefully eventually going to be doing more research in women.
And I'm sure in general, sort of having a healthy sexual relationship with your partner is extremely important to your marriage.
Right. And one thing too is these are some drugs that we're talking about to help sexual satisfaction, but in general, having a good relationship, communicating well, if you need to go into a sex therapist, going to a marriage and family therapist is important as well. You can't take these drugs and be with someone that maybe isn't the nicest to you and still experience the results.
Right. So how common is it for couples to have issues in the bedroom?
It's very common. I would be out of job if there wasn't. In terms of climax problems, it's a quarter of women experience problems with that, and it's the second most prevalent sexual dysfunction next to low desire.
Okay, well, thank you so much. This is really interesting stuff, and you guys are doing some great work over there. And if you guys at home want more information on the San Diego Sexual Medicine, you can go to our website and click on the Scene On tab. Thank you so much, Rose.
Thank you.
All right, Paul, over to you.
All right, thank you, Ellie.